The North State's pretty special compared to other areas, in my opinion, in California, just because we're rural. There's tons of things to do outdoors, yet you're within about 3 hours of any of the large cities. My name is Roger Page. I'm the Dignity Health North State Market President. So we have 4 really great hospitals in the North State market. We have clinics all the way from the very southern part of our counties to all the way into Siskiyou County in the north. We get all seasons, and so the benefit of that is if you love outdoors, we have the most waterfalls, hiking, access to lakes within close proximity within California. It's just a great, safe place to raise your family.
Mount Shasta is a special place. This is a special hospital. I think there's no place on earth like this where you can just drive up, look out the back door, and see that mountain. Is just fantastic. And I can't recall a time where there was a sunrise when I was showing up or sunset where I just didn't pause in the parking lot and take a photo.
We're one of the most rural counties in California, only about 7 to 8 people per square mile. We're the only hospital in the local area. And we're all very concentrated in little spots. So a lot of mountains, a lot of lakes.
It's a small town atmosphere for sure. Mom and pop places, quite a few restaurants, just because probably the tourism that we have in this town, because it is an attractive place to live and play. There's just a little bit of, every type of food that you can think of. On the 4th of July, we have just thousands of people come to this town for a parade. There's a walk run. It's a 5K or 2K, whatever you want to do. Just a fantastic time for the family. The relationship between the community and hospital, it's a small hospital and it's a small town, and so I think they're well matched. Feeling that you get when you walk in here is that you're not just treating patients, you're treating your friends, you're treating your neighbors. It's a good place to work.
The thing I find the most rewarding about my job is the ability to practice medicine at the top of my license, that I can provide a lot of good care for my patients. It's an amazing place to live, and I love living here, and I love practicing here, and I love the autonomy, I love the freedom to practice medicine as I see fit, and be able to go skiing in the morning and go ride my mountain bike, pass that off with a run, and go golf in the afternoon. Why wouldn't I want to live here?
60 miles to the south, we have Mercy Redding. It's a 267-bed Level 2 trauma center, Level 3 NICU, cardiac services, cancer center, really the only trauma center north of Chico, all the way to the Oregon border. We've got a great family practice residency program tied in with UC Davis. Lots of residents working through our hospitals, and if you love to teach, there's an opportunity.
We needed a place that had a lot of exposure, proximity to the environment, but also had weather that was great year-round, and Redding checked all those boxes for us.
We feel like we're really fortunate and blessed to be living in a city like this, and it's something that we hadn't heard of till we were on the job search, and then Redding came up, and here we are, and we've loved it.
It's a 10-minute drive to get there almost anywhere. You can fly to almost any major city. You can go to LA, San Francisco. They just opened up a new Denver connection. And then you can even go international.
There's a historic Cascade Theater downtown where we were able to see the Nutcracker, the World Ballet. There's also the Civic Auditorium where they have concerts on the lawn. Glowing Wild event at Turtle Bay. It's this light up art installation with lanterns, and you can walk through kind of at your leisure. But Turtle Bay is always putting on different events. So it's a museum, an aquarium, and they have like little animal shows, and they have a big Christmas light event. So that's one of the fun things you can do as a family.
My favorite place to go is Whiskey Town Lake, and that's because I have my sailboat there. And there's a big sailing community there, which is awesome.
I feel like that's very Redding, to go to the lake and then come back and work without having to leave. It's like half an hour away.
The terrain, the variety of outdoor activities here is like unparalleled.
Every first Friday, there's actually a cultural event called Afro-Latino Night, and where they have outdoor salsa, and so the community comes together, and there's food trucks, and that's a real fun thing to do.
I was looking for a rural NICU that was part of a community system, but that had support from a bigger standalone children's hospital. So here at Dignity, it's like a small community environment with the support of a bigger system without having to be in the city.
The hospital has very high acuity patients, and I felt that coming out of residency, that would keep my skills intact and keep my skills sharpened.
For family medicine, you're seeing rashes to all kinds of chronic disease, acute disease of all ages.
While we're able to provide the majority of support to provide neonatal critical care, we also have the added ability to have the pediatric specialties or the NICU on call, as well as emergent transport if we need it.
There's so many activities you can do. It's kind of a choose your own adventure.
South of Mercy Redding, there's St. Elizabeth Community Hospital, so the only hospital in Tehama County. It's a 76-bed community hospital, also a level 3 trauma center.
And as you approach Red Bluff, you can certainly take in the beauty that you see that surrounds you. When on its last in Volcanic Park, Mount Shasta, Trinity Alps. When you get to Red Bluff itself, you have the Sacramento running right through the center of town where you see people fishing or boating. And then downtown, you get the quaintness of some of the historic buildings that have been there for quite some time with small business owners, restaurants.
I have a 7-year-old son, and we attend public school, but there's also private schools available, and the public school he attends is excellent within the state of California, and it's an A-rated school. So we have excellent school systems here, both public and private.
Anyone who's lived in Red Bluff always knows about the Red Bluff Roundup. I think the Roundup has been here more than 100 years, so there's a lot of legacy, a lot of pride in the events, and I think when that time starts to come around and you get that sense of pride, our patients come in, they're wearing their cowboy gear. I think one of the beauties of coming to Red Bluff is my ability to have my own practice. So I'm able to take care of the patient the way that I best see fit and build the best care possible. And I think the ability to do that and also maintain a practice where I'm able to separate work life as well as my professional life, where I've been able to have that balance of both work and family.
So we have the resources right here, and I feel like families appreciate that. If there were an issue where we needed to have a higher level of care, Sacramento and San Francisco are not that far away. So communication, I feel like, is very vital to providing appropriate patient care in this community. Because we're so close-knit, everybody, including patients and including my colleagues, we know each other very well. So if I have a patient that I need to send to the ER, it's not that much of an issue because they already know there's the trust that's already been established. So that's really rewarding.
So physicians are moving here because they want balanced quality of life, and we've got it.
We love it, and we're hoping we can get more people out this way, not only for the outdoors and the beauty of the city, but Dignity Health has been incredibly supportive, and we're very happy that we've moved here.
Hiking, biking, rafting, every minute, I'm going on a hike after I'm done with this video, so